Hi, hope you're all well. I'm Viv and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. And although it's a different time of the week, Sunday morning, I'm going to be doing another live with a guest joining us. Hi Stuart, hope you're well. And this week, myself and Sunny, who normally do the lives, Sunny's unfortunately tied up with some other bits and pieces, but he'll hopefully be back on Thursday when we'll be doing another live. But this evening in Australia, in Sydney, I've got the very nice Stuart Turner from Vinno in Australia. I'll just add him on now. Won't be a second. He should be joining me any second now. I'll let him introduce himself once he's joined up. Shouldn't be too long. Hi, Stuart.
Hey Viv, how you going?
Fine, fine. It's not too difficult a time for you right now, is it?
No, it's perfect. It's actually a good time.
Great, great. Thanks for joining me. As I was just mentioning, Sunny unfortunately is tied up with some other bits and pieces. Let's just say for Halloween's sake, he's stuck in a haunted house somewhere and can't get out. Hopefully he'll be free by Thursday next week. So we'll see what happens
Yeah,
then.
thanks for that
But that,
picture. My friends loved that one.
oh, right. I thought it'd be nice just to put a Halloween theme in towards what we were doing this evening. So thanks very much for joining me. Um, just to let everyone know, you're based in Sydney in Australia, Stuart, and
Yeah.
you run Vinno Australia. And uh, just to introduce yourself, basically, tell us a little bit about what you do, how you've progressed to where you are now, and the different things, the different types of things that you do, and we'll go into more detail afterwards, if that's all right.
Yeah, sure. So Vino is a big ultrasound company and they have distributors all over the world. We've been the distributor, Real-Time Ultrasound Machines has been the distributor, which is my company for Vino for the last 7 years. And we work in all sorts of fields. Musculoskeletal ultrasound, we do obstetrics and women's health. And this year we've done a lot in the aesthetic world, which has been fantastic.
Yeah,
Yeah,
yeah. What about what about your background? You're a trained physiotherapist, is that right?
that's right. So when I was at school, I wanted to be a physio. That's how my career started about almost 20 years ago now. So I went into physio and came out doing exactly what I wanted to do, which is working with the sports team and in private practice as well. And I did that for probably about 5 or so years before I started to get interested in ultrasound. Basically the way I got introduced to ultrasound was through using it in my physio practice.
Right, right. And so you've progressed working as a physiotherapist, you got into the whole area of ultrasound use. How did it come about getting from physiotherapy into the whole arena of ultrasound use? Did you start using it in your physiotherapy work and it progressed from there?
I did. I mean, one thing that I found working as a physio was that, in Australia anyway, we're actually quite limited in the type of stuff that we can do. So, once you've been a physio in Australia for a short amount of time, and for me it was about 5 years, you find that you're doing the same thing over and over again. So I was looking for something new, to kind of add to the practice to keep me interested. And ultrasound was something that other physios were using in particular to look at the core muscles. So we were looking at muscles which, at the time, people really thought they were very much connected to back pain, and a lot of people still do. And we were using ultrasound for this really specific purpose in physio that other professionals, say radiology or sonography, they wouldn't use ultrasound for this. So, it was very specific to physio in the same way that I think now in aesthetics, practitioners are starting to use ultrasound in a way that's very specific to their practice. So I started doing it for that reason, and I really fell in love with it because you could see exactly what was going on under the skin surface. But just as importantly, the patients absolutely loved it as well, because it's one thing to kind of tell somebody something or show it to them in a textbook, but when you can actually show the patient what's happening with their own body in real time and they can see that on the screen, it really gives you a lot of buy-in, and the patients can understand exactly what you're talking about. And it was really great for not only for me, but for patients as well. So
Yeah.
I did that type of ultrasound scanning for a little bit, and then I started to get interested, okay, what else can we learn? So I started to learn a little bit more about, scanning tendons and shoulders and things like this. And eventually, even when I was doing dry needling, for example, which is just kind of like acupuncture, you're sticking acupuncture needles into muscles. So for certain areas, like if you're going to do around the rib cage or the thorax, there's a chance you could go into the lungs, I'd use ultrasound to make sure that I was as safe as I could be. Or that, there's certain muscles as well that you really need to be careful around because there's big arteries and nerves and things like that. So ultrasound was fantastic for that. So yeah, so I did that for a little while as well. And I had a few physio practices, and it just got to the stage for me where I was again still looking for something new and something interesting, and I decided to start a business of importing ultrasound machines to sell to other physiotherapists at first, and to give them training in how to use those machines in their practice, how to get the most out of it for their patients and for their practice as well. And eventually I started to get referrals from sports physicians who wanted to buy an ultrasound machine because they'd been referred to us by a physio, and then it was an anaesthetist, and then it was an obstetrician, and it just kind of grew from there. So yeah.
I mean, you've done a lot. You've done a lot in a short space of time, I think, Stuart. Just for anyone who's just joined us, this is Stuart Turner, and he's based in Sydney, Australia, and he runs Vinno Australia, who are the equipment importer and distributor around Australia. So you've progressed, and you're using ultrasound. You've been using it for a number of years now in your physiotherapy work. Is that right?
Yeah, that's right. So, so I'm not seeing patients as a physio anymore. Ultrasound distribution, it's a big job. And this is what I do full time now. I still own a physio practice, so I'm still kind of involved, but not day to day with patients or anything like that. And yeah, so what I do now is essentially selling machines, give demonstrations, organize training sessions, and everything else that goes along with that.
Amazing. It's just that myself and Sunny, we've spoken to other practitioners in Australia, and I think you know them very well, Dr. Jake Sloan and Dr. Martina Lavery. And you were involved with training as ultrasound aesthetics training with them a few months back, I think. But how did the progression into aesthetics come about, Stuart?
So that was through my wife, actually. So she was seeing a doctor here in Sydney, Dr. Naomi, and this was a couple of years ago. Actually, some of it even goes further back than this, but I'll start with this. So a couple of years ago, Dr. Naomi started posting about ultrasound use in aesthetics, and my wife said, "Oh, they're talking about ultrasound. You really got to get in touch with them." So she set up an introduction with Dr. Naomi, and I came in to give an in-service. And at that stage, I really didn't know anything about ultrasound for the face. I don't think many people did. This was going back a couple of years ago. So I was like, all right, what do they want to know? So I asked a few questions. What do you want to know? And the main thing was about the arteries. So I'm like, all right, we can probably figure that out. So I went and I got a textbook. We got the, how to look at the arteries, and we just went there and I introduced the technology, and really they were leading the training, and they said, all right, let's find this artery, let's find that artery. So we'd put it on the face, see what we could find, optimize the settings and all that type of stuff. So that was really the first real introduction, and Dr. Naomi really got on board with it, and she's been very supportive ever since, and kind of set up a few, she bought the machine for her practice, and she introduced me to people in her practice, Dr. Chris Rogan, who's an interventional radiologist as well as an injector. So, introduced me to a few people, and we've started the training from there. But it actually goes back even further, because I can remember 5 or so years ago, I was, getting the occasional interest from aesthetic doctors here in Australia. And one of them just bought a machine a couple of months ago. I ran into him at a conference, and, he was first inquiring 5 years ago, and was like, I wish I'd got on board with it back then. I would have been, I would have been one of the first. And I'm like, well, you still kind of are, because it's all pretty new.
Yeah, it's just in the UK where I'm based, it's really only been the last couple of years where things have really progressed. But in terms of training, I was talking about you knowing Martina and Jake in Sydney. Yeah. You've met them both through training, I guess, a few months back when you were involved with Cutaneous, who were based in Amsterdam in the Netherlands. And I've always got to mention a name, Dr. Leonie Schelke, whatever we
Yeah.
do involving ultrasound, I always end up mentioning a name, so I thought I may as well chuck it in today as well. But it's Peter Velthwis, I think, who you met over in Australia. And
That's right.
how did the whole aspect of training, provision of the ultrasound
Yep.
aesthetics training, how did that come about?
That's a good question. I actually can't remember exactly how it came about. I mean, ever since I got involved with aesthetics, you know, I've met people, a lot of people just, you know, like yourself through Instagram, and the community's actually been extremely welcoming. So Leonie, you know, we've just exchanged messages over the last couple of years, and I think even with Jake, when I found out that he was bringing cutaneous out to Australia, I think I might have just messaged them and said, hey, can I give you guys some machines for the course? Can I come and help with the training? And I think that's probably how it happened, if I'm remembering it correctly. But you know, everyone's been fantastic and welcoming, and you know, whatever knowledge that I can bring from my background with the machines, or you know, just from with what I've learned, I've brought it there. And I think yeah, it was, I mean, those workshops were amazing. I got to do all three of them, so they did a Wednesday, Saturday, and Sunday. So that was really awesome for me to be involved with, you know, so much of that training during that time. And yeah, so really, really fantastic workshops.
Great. And who do you train? And have you got plans in the future for more training provision around the Sydney area, or are you expanding further?
Yeah, look, hopefully if Cutaneous comes back, I'd love to be involved with them again. In Australia at the moment, we are, obviously we sell machines for, you know, aesthetic practitioners. So we also have to run our own training to make sure that the people who are buying the machines get looked after as quickly as possible. So we've been running some workshops, mainly for our customers, but also for other people who are interested to come along as well. So that's been with Dr. Chris Rogan. We've done a few workshops already this year. So like I said, he's a interventional radiologist, knows a lot about the aesthetic space as well. And the other person is Lisa Hackett, who is the ultrasound educator. So she is, you know, an award-winning sonographer, educator, very, very passionate about teaching, but also very passionate about aesthetics as well. So you know, when she found out or saw through Instagram that I was doing stuff in aesthetics, she called me straight away and said, hey, you know, we got to run some courses. We got to do, you know, we got to get out there and teach this. And she's really passionate about it too. So, so yeah, at the moment in Australia, we're running workshops as often as we can. And I think we've done a couple in Sydney, and we've done one up at the Gold Coast as well. So, you know, next year it'll be really interesting to see what happens. And, you know, we'll try and fit in with whoever's coming out to teach, and everyone that's already teaching.
Do you get on with other specialists in Australia? I think Mobin Master, the radiologist. It's purely because I'm setting up a research database, you know, of work carried out by practitioners and researchers around the world, and a lot of his work pops up involving radiography and ultrasound in particular. Do you get on with the likes of Mobin?
Yeah, absolutely. We had a dinner down in Melbourne a few weeks ago, and he came down, and it was fantastic to have him there. He's trialing one of our little handheld ultrasound units at the moment, so hoping to get his feedback on that one very shortly. It's a new wireless ultrasound unit from Vinno. It's really fantastic. So we'll see what he has to say about it very soon, I'm sure. But yeah, Mobin's great, and you know, again, like a lot of people in the aesthetic space, he's very generous in terms of sharing his knowledge that he has and the info that he has. And, you know, I've got customers who've called him, you know, and got help from him for vascular occlusions and things like that. So, so yeah, absolutely. We try and get to know everyone who's doing this type of work in Australia, and he's definitely one of the top people.
Yeah, amazing. It's just that myself and Sunny, we speak to a lot of different practitioners and trainers and researchers around the world, and it's amazing how much knowledge they all have and are willing to share with everyone who's interested in the subject. But in terms of the actual equipment itself, Stuart, with practitioners thinking of using ultrasound, may not have decided for definite that they want to buy equipment to use in their practice, but in terms of the equipment, how would you say the equipment differs from one brand, one type of device to another one. If somebody it really doesn't understand and wants to know what's the difference, what makes the difference, what's going to get me to buy one piece of equipment compared to another one, what would you say to them?
Yeah, I think it's actually quite tricky with ultrasound because unlike some other devices, you can't judge an ultrasound based on its spec sheet. So you can't look at one scanner which has, certain number of frequency, certain number of dynamic range, etc., and say, oh, this one's better than the other one. It's one of those few pieces of technology where you actually have to see it for yourself, at least see the images or at least see the video for yourself. So that's the first thing I'd say, is that you can't rely on the specifications alone. And the other thing that I'd add to that is I think there's been some really good marketing about frequency. And a lot of people, the first question that they ask is, how high does the frequency go? And so a lot of people have got in their mind now that higher frequency means better quality scanner. But frequency is just one small part of the puzzle when it comes to ultrasound. And in fact, if the frequency is too high, you miss out on penetration. So even in the face, I saw a live that you did with Dr. Stephen Weiner, and you were talking about a particular unit which has a very high frequency, but it struggles to visualize deeper arteries. So that's the other thing that I'd add to that. I think frequency is important, but it's only a very small part of the puzzle. So I guess the short answer to the question, unfortunately, is you have to be able to see the pictures of the images for yourself, if not actually get to hold the scanner and see what it's like. So when people first contact me about buying an ultrasound machine, there's not one machine that I just say, hey, you have to buy this machine. We usually ask quite a few questions to figure out, what does that person want? Are they always in the same room at the same time? Well, if so, why would you look straight away for a handheld or a super portable device? Because you might find that you can get more value for money in an entry-level, desktop device or something like that. So I think for aesthetics, at the absolute least, you need to buy a good quality device because you're looking at small arteries in the face. So if you're going to buy a handheld device, there's definitely ones out there. Like we have the Vinno Q. I can show you that one here. So this is one of our little handheld devices. So something like this is going to be a really good starting point for facial ultrasound because it has good image quality, it has good Doppler sensitivity, and yeah, it's a good quality unit. But most of the time we tend to end up, advising people, if they're thinking about doing it for the longer term, to get a entry-level portable unit, something that's good quality, something that's going to last 10 years, and that you're going to be able to upgrade over time. So a lot of the Vinno machines, for example, they'll give you a software upgrade every single year. So the machine actually gets better over time rather than something that, is potentially only... There's a couple of devices out there on the market that I see right now that I think they've probably only got 3 or 4 years in them. They might overheat or they might have other issues. They probably don't have that long lifespan. That's a really long-winded answer to a very simple question.
No, it's a good way of describing the fact that there's no simple answer to that question. It involves a lot of different parts. And in terms of practitioners who are thinking of the device and using it, do you come across practitioners that may end up you thinking they're going to just put it away and keep it locked, put it in a cupboard somewhere, not use it, and only use it in an emergency? What do you think about the idea of using the ultrasound in your own practice once you've got it?
Yeah, I mean, there's a couple of things there. So number one, going back to your previous question, when you go to buy an ultrasound machine, make sure you speak to somebody who actually knows about your industry. So if it's aesthetics or something else, talk to somebody who actually understands exactly what you need, because they'll be able to point you in the right direction, and they'll make sure that you get a scanner that's, it's not only going to fit your needs, your budget and all that type of stuff, but it's going to be usable for aesthetics. And the second part of that is make sure that you have some option for training, because if you buy an ultrasound machine without an option for training and you don't have someone that you can call when you need help or just send a message to or whatever, an email, then it is going to sit in the drawer. That's the reality. If you don't know how to use the device, then you're not going to get the most out of it. You're going to get frustrated, and it probably is going to sit in the drawer. And then in terms of, do you use it all the time or just in an emergency? I think that, you know, for me, I would probably tend to use it a lot of the time because I think it helps to answer a lot of really important questions. I mean, you would know this better than I would, but every practitioner is going to be a little bit different. And I think you just need to figure out exactly where it's going to fit into your practice. You know, even as a physio, even though I loved ultrasound and I would use it a lot of the time, there would be days, maybe even weeks, when I wouldn't use it because I wasn't seeing patients who needed it. I wasn't doing type of treatments that I needed to. And I'm sure that's the same in aesthetics. There's going to be certain, and I've heard people that you've spoken to, and they don't use it all the time. You know, they use it for very specific things that they want to know. It's all about using it as a tool to answer those clinical questions. But yeah, in terms of emergency versus everyday use, if you'd asked me that a couple of months ago, I probably would have had a different answer, but now I think that if you're not using it all the time, you're not going to be able to use it very well in an emergency. And so I think that having it there and just thinking, well, one day when I need it, if I need it, I'll be able to pull it out and use it. You probably won't, because you just won't have the practice. You won't be good enough at it. You won't be able to, you know, see where that occlusion is. You know, it's a skill, and it's something that you get better at with time. And so I think that, you know, if you want to be able to use it for an emergency situation, it's really handy to use it for non-emergency situations beforehand.
Yeah, no, I agree. It's just for myself, starting off using the device that I use a Clarius. It's quite a steep learning curve. It's not a particularly easy area to start with when you've got no experience previously. And I think it just takes a lot of practice. The more you work with the device, the more patients you see. It helps you to grow in confidence and ability. You tend to learn muscle memory. You know, the way you move your hands around the device and across the face, you gain experience by doing that. And in my experience, you really need to practice a lot at the beginning and continue doing it regularly. In terms of education and training, with practitioners who may have undergone basic initial training when they're thinking about a device or may have purchased a device already, what do you think about ongoing training, you know, over a period of time? Just like CPD, for any practitioner, healthcare practitioner, we all need to maintain continuing professional development. But I think it really is important in ultrasound training as well. Would you be involved in ongoing training to train practitioners over a period of time?
Yeah, absolutely. I think exactly what you're talking about doesn't really exist right now anywhere that I can think of in the world. I think there's definitely a need for it. At some point that might be, you know, where the colleges come in. I'm not sure if they may have plans to add that in the future. I know in Australia, the Australian College of Aesthetic Medicine has been quite interested in ultrasound training already, and, you know, whether they have plans to add something to their curriculum in the future, or some kind of course or pathway there. Certainly it's what's happened in other professions, you know, obstetrics, for example, anaesthetists, they have training built into their specialization. So at the moment we don't have that yet, because people are still, I think, in the beginner stage, and perhaps the people like yourself who've been using it for a while are already kind of, you know, at the level where they would be giving that next lot of specialist training. So yeah, it doesn't exist yet that I'm aware of. Have you come across anything more advanced training?
No, there's different types of training, like as we were talking about cutaneous. Leonie and Peter, they organise training all over the world. And I think Leonie's over in Los Angeles right now in the States doing training there. But I think they're concentrating on training to help beginners from the start. There's more advanced training I think they provide as well, but I don't know of a controlled method by which practitioners can enter a stage of training and progress along it. As you say, I think that involves work with education providers and the Royal Colleges, you know, who would help to organise training in an accredited form that can be done properly. So hopefully that's something that will progress in future.
And I think that'll probably answer some of your, you know, questions or, you know, curiosities about how people use this, because if there is a standardized pathway, then, you know, people can choose where they kind of sit on that, you know, level of training as well.
It was actually, I was talking to myself and Sunny, we were talking to a sonographer in Portland, Oregon last week, Candice Dealey.
Yeah.
Candice, yeah. Do you know her? Have you come across her?
Same thing. We've chatted on Instagram just randomly as well. So yeah. It's actually a relatively small community, I think.
Yeah,
I think so.
I think we're running out of people to speak to each week. You know, myself and Sunny, we've spoke to most of them over the last 6 months already. But one of the things we were talking about last week with Candice was certain posts on social media over the last few weeks that were having a little bit of a go at ultrasound and maybe some of the people around it. Scaremongering, you know, the public and scaremongering practitioners. What, in my experience, myself and Sunny, we've just been describing our own journey and how we've spoken to specialists about the subject of ultrasound in aesthetics. But what do you think about that? What I don't know if you had any thoughts about the scaremongering issue that some people are saying that's going on.
Yeah. Look, I mean, I also hadn't seen the scaremongering myself, or I hadn't interpreted it that way. To be perfectly honest, I do try and stay out of it a little bit, try and stay a little bit more neutral as, you know, as a distributor. But, you know, I did make a comment on one thing, which was just an observation of mine, was that I can't think of another industry where there's a stance either for or against ultrasound. You know, I think the time for that argument was probably 30 or 40 years ago when ultrasound was first, you know, invented. You know, there's not this, you know, it just doesn't happen. You know, you don't see, you know, an obstetrician, for example, saying, I do not believe in ultrasound. It just doesn't happen. They may choose not to have an ultrasound in their room. You know, most have one, but they may choose not to. But I think they certainly wouldn't be against the use of the technology. So I find that quite interesting. You know, as far as scaremongering goes, and do you need ultrasound to be safe necessarily? You know, I think that's a very valid argument as well. In my personal opinion, I think it's not going to take anything away from your safety. I don't think it's going to make you any worse. I don't think it's going to give you any less information. So, you know, how you use it and all that type of stuff. But yeah, like I say, it's something that I probably stay out of. I'm not an injector, so, you know, I can't speak to that. What I have noticed, though, is that the people who are, you know, teaching this, I think they're not doing it as their main source of income. They're not doing it to, you know, to become famous or something. They have a genuine passion for what they do. They're very generous with their time. They're very generous in terms of sharing their knowledge and their research and all that type of stuff. So no, I don't really buy into them scaremongering to force people into using this technology.
Yeah. It's just something I thought would be interesting to talk about. That's all.
Yeah, it is. It's a fascinating, you know, thing. I haven't come across it before. It's really interesting.
It's some comments get on my nerves, and I always end up having to say something on some of the posts that I read. Yeah. So I try not to be too argumentative, but sometimes I just can't help it, unfortunately. But things like one of the things I was going to ask you about a practitioner who may be thinking about training to carry out ultrasound in their aesthetics work. They may have gone through the training. They may be in a position where they can start using a device. How would you advise them about implementing the actual scanning within their normal work if they've got no plan as such, you know, about using it? They may be worried about the time it takes to use the scanning, you know, within a process, within a plan of work that they do in the clinic. What would you advise them about implementing scanning?
Yeah, look, I think you'd have to bring it back to ultrasound as a tool that you're going to use to answer a clinical question. So it depends on those questions that you have that regularly come up in your practice. Is it about safety and finding where the arteries are? Is it about knowing what's under the skin surface, as in, you know, is that little bit of swelling caused by filler, or is it fluid, or is it something else? You know, so I think that's the first question you really have to think about. I think there's going to be, again, I don't think there's going to be one answer for everyone. I don't think everyone should have to use ultrasound the same way in their practice. I think it's really open to using it as a tool that fits your practice and the way that you're going to do it. And I think talk to your peers, talk to your colleagues who are already using ultrasound. You know, it's fine for me as a non-injector to say this is how I would use it. But fortunately now we have, you know, hundreds of people out there using ultrasound who are typically very happy to share, you know, their approach to using it. So I think that's probably a better question for you, to be perfect. I mean, how do you use it? Are you using it, you know, on every patient? What are you doing?
Use it regularly. You know, it's not just about the patient, but also it helps you learn about anatomy, which you
Yeah,
just wouldn't be able to do without the device. I use it in pretty much every patient I see on a daily basis. So
yeah,
every filler, dermal filler patient, vascular mapping with all of them, and doing that also improves my ability and experience of using it in other patients as well.
yeah,
I also use it for toxin injections, for masseter injections, to assess muscle depth and again look at the
yeah.
anatomy. But using it also for guided injection, it's very useful, and it gives me it makes me feel safer in the treatments I carry out for patients. As you said right at the beginning, patients enjoy being able to see what you can see, and they
Yeah,
can work out exactly why you're doing something, why you're recommending that for them. That's what
yeah,
I feel.
absolutely, absolutely. You know, if I was a patient, I would love, you know, for the injector to be able to explain all of that to me and, you know, the exact layers and the anatomy and all that type of stuff. Because as you, I'm sure you've seen, everyone's anatomy is actually quite different, and a lot, it doesn't
Mhm.
look very much like it does in the textbook. It really doesn't. When you put the scanner on, you'll see most things are just a little bit different to what, you
Yeah.
know, is illustrated in textbooks. But yeah,
It's just again going back to Leonie. I always have to mention her a few times during a live with about ultrasound. But just yesterday, she's published some work with Peter Beltwis and Sebastian Cortefana. They've published some work looking at some uh, new data that they've found as a result of using ultrasound about backflow when you
yeah,
inject filler into tissue. One of the things that was never identified previously before ultrasound was used
yeah,
was the fact that when you inject into a certain depth using a needle or a cannula in particular, you get backflow of filler
yeah.
along the whole length of the needle that's progressed to that point. That's
This was
one
one of the
thing.
first things that we noticed when, you know, we put the ultrasound machine on, you know, going back a couple of years, and
Yeah,
people are like, that's not where the filler's supposed to be.
yeah.
That's where it is.
There was another thing. There was two past parts of that work, and the second part that they identified again over the last couple of years, certain tissue within certain areas of the face called SMAS.
Yep.
When injecting with a needle, you'd assume that the needle passes straight through the tissue and it touches the bone, say for a cheek injection. But
Yep.
what they've found is a lot of the times when they're doing assessments of the tissue after a treatment's been carried out, the filler's actually in the SMAS. It hasn't penetrated. It's actually stayed in this layer, which ends
Right.
up causing nodules and all sorts of problems afterwards. And that's, again, because of ultrasound.
Wow. Yeah.
So,
I mean, it's so easy. It's so easy to check that. It's so easy to see
yeah,
that as well, and it's incredible. Yeah, it really was one of those really interesting things, and why, you know, why it's been so enjoyable to work in this field in the last couple of years is there's just such a strong use case for it, and when
yeah,
people see what's actually happening for the first time, they're blown
yeah,
away. You know, they're like, wow, like that's where that is, and that's where this is,
yeah.
and you know, that's where, you know, it's really fascinating.
In the future, looking at what may change over time, I suppose equipment will improve, equipment
Yeah,
will change. Also, software within the device will always improve. And there's the manufacturers, the developers of the equipment tend to produce software updates to improve what can be carried out and how well it's done as well. I was interested when you posted a while back, Stuart, using one of your Vinno devices, I think it was. You carried out a scan of, I don't know if it was a temple or another part of somebody's
yeah.
face. You created a 3D image based on multiple scans using ultrasound. Is that part of the software in the Vinno devices?
It is. I've got one here. I wonder if it's got 3D on it. I could show you, but it's all you do is you sweep the transducer across the head in real time, and
Yeah,
as you're sweeping back, the machine is memorizing all of those
yeah.
layers or all of those images, and then at the end, you just press the button, and it prints out this 3D image, which that you can then rotate and move around. So yeah, so it's a really good way to appreciate things in 3D.
It's amazing. It's amazing what things are progressing in terms of using ultrasound. What would you say is the future of ultrasound in aesthetics for practitioners and for patients? What do you think is going to be the future of the technology?
I do think it's going to become a standard of care for most people. I don't think everyone is going to, in aesthetics is going to buy an ultrasound scanner. I think that there's always going to be people who either resist it or choose not to upskill in that. And, perhaps they may even, refer onwards when they, need something dissolved or get an occlusion, whatever. I do see it becoming the standard because you're right, the technology is going to improve. Scanners are becoming more affordable to a large extent, or at least they have done over the last 10 or so years. The image quality is getting better. So if you look at these handheld devices that are out there now, which you can get for less than $10,000, that was a $100,000 big computer, not that long ago, within the last 10 years. So I do think it's going to become more and more accessible, and more people are going to start to use it. And I do hope that it becomes a standard of care, because I think that, it really is showing, what best practice can be, and, upskilling to that extra level for the patients.
Yeah, well, thanks a lot. That's pretty much it, Stuart. I think we've covered everything. It's been about 35 minutes or so we've been talking, so it's gone well. Really nice speaking to you. It's really nice for you, really nice for me to be able to speak to you this evening in Sydney. We'll hopefully maybe do a live again in the future some point, and we'll be able to go through what's changed since today's live. And it'd be nice to be able to talk to you again, if that's all right.
That'd be awesome. We can show you some of those cool features and stuff one day, maybe.
Yeah, hopefully at some point in the future, we may well meet up, myself, Sunny, you, and maybe Jake and Martina as well, maybe meet up in Australia at some point. It'd be nice.
You'll have to come to Australia.
It'd be nice to see you all together. So thanks very much for that. Next Thursday, I think Sunny will hopefully escape the haunted house and he'll be able to join me for another live on Thursday. We haven't got a guest in next Thursday, but I think what we'll do is a review of people we've spoken to over the last couple of months. It's always nice to go back and see what we've talked about with different people. But we'll be doing that on Thursday the 27th at 8:30, and hopefully we'll get people interested in looking at what we've done over the past few months. But again, just wanted to say a big thank you, Stuart. For anyone watching, this is Stuart Turner. He's with Vinno Australia, and you can follow him on Instagram with the ID. It's realtime_ultrasound, is it, Stuart?
That's right, yeah, real-time ultrasound. Yep, with the underscore.
With the underscore. Follow Stuart, and anyone who has maybe questions about equipment and training, you'd be happy to answer questions.
Yeah, absolutely. Even if they're from the UK or somewhere else, anywhere in the world, if you've got a question about ultrasound or a particular technology or a particular scanner, please ask. I'm always happy to give feedback. If I know about the product, I'll definitely, give honest feedback.
Great. Thanks very much for that. You're based in Sydney in Australia, just for anyone who's in that area. Great. That is pretty much it. I just wanted to say a big thank you again, and have a great rest of today, although it's late evening now, I think, isn't it, for you over in Sydney?
It is. Yeah. Thanks so much for having me on, and I hope you enjoy the rest of your weekend, Vin.
You too. Thanks a lot, Stuart. I'll catch you again soon.
Thanks. See you soon.
See ya.